Hello, I'm Dr. Irene Fautier, neurologist. I hope you are fine. I'm fine as well, thank God. Like I promised last time, 1 week ago, on my Facebook channel, that I will talk with you about epilepsy. I know, my dear, I know that you are suffering from epilepsy, but just know it's not the end of the world. With epilepsy, you can drive, you can just have a normal life. Just follow my advices. What is good for your brain to avoid seizures? First thing, my dear, sleep properly, 7 to 8 hours per day. That is really important. Drink enough water, 1.5 to 2 liters per day. That is so important. Avoid alcohol consumption, avoid drug consumption. I mean cocaine, cannabis, amphetamine, marijuana. That is not good for your brain. Ban it. That is not good. Another thing, my dear, during the first 3 to 6 months, from the beginning of anti-epileptic therapy, avoid driving. Avoid driving car, bicycle, motorcycle, swimming. That is really important because in this time you want just to see how you are responding to the therapy. It can be really fatal if you have a seizure while you are driving. It can be really fatal. That means in this time, avoid driving. After this time, you can go back to your neurologist and talk with him. It will give you the authorization to start driving again. Another thing, take your therapy. That is so important. Take it regularly. Some epileptic patients, they just forget to take the therapy or they don't take it at all, and they have more seizure than before. Always take your therapy, and in addition, always have your emergency therapy with you. The emergency therapy, you have lorazepam, clobazam, tavor, diazepam. Always have it with you and let know everybody, your friend, that you are suffering from this disease. A lot of people feel ashamed to say that they are suffering from this disease. And in case of seizure, nobody knows how he can behave. It's really important to let know that you are suffering from this disease. Don't be ashamed. Epilepsy is a chronic disease like all the other diseases. I know some people won't agree with what I'm saying, but I think I always see I have a lot of patients. They are medical doctor, engineer, a lot of people. Lot of VIP, some VIP suffering also. They also suffering from this disease. And it really, really important. Please, my dear, don't be ashamed. Just tell that you are suffering from this disease. Okay? Another thing, if you avert that you are going to have a seizure, please go in a safe place. You can just lay down. How you avert? Some patients, they know that they're going to have a seizure. With dizziness, nervosity, restlessness, and just go in a safe place and take who is around that you are going to have a seizure. So he will know how he can behave. That is really important. Now I'm talking to you, relative, friend of epileptic patient, how you can behave in case of seizure. Just follow the video. Most of the times, it's not the seizure, the matter, but the complication of the seizure. It's the complication of the seizure. The most complication of the seizure, you can have brain hemorrhage, you can have aspiration pneumonia, you can have injuries. That is really important that you behave properly to avoid such of complication. Another thing, don't be afraid. Don't be afraid. It can happen that in case of fever in case of infection that you have more seizure than before. But in most of cases, with the treatment of fever and infection, most of the time, everything go back to normality like before. All right? Most important is to know that. Yeah? But because sometimes, in case of fever, of infection, some patients, they have more seizure and they change the therapy themselves. Don't do that. Yeah? Don't do that. Just go to hospital and they will know how. The most thing is to find why you have fever and to treat the infection. And most of the time, everything go back to normality. My dear, follow the videos, follow it and share. That is really important. Share it with your knowledge, your relative, friend. You can save lives. Many people are ignorant about this disease. Yeah, and like, I'm also open. You can also give critics. I'm really open. I am francophone and I'm doing my best. I just want to share with the world my knowledges. That is really important. Critic are welcome. Questions, you can also ask your question in comments. And take care of you. Take care of you. Share. Bye.
With epilepsy. His seizures can be quite sudden, where his body suddenly stiffens and then he starts to shake. This is known as a tonic clonic seizure. If someone you were with had a seizure, would you know what to do? Would you know what not to do? Knowing how to respond with basic first aid can help keep the person safe. Witnessing a seizure can be frightening. It is important that you remain calm. If the person is lying face down, or if there is any food or liquid in their mouth, roll them onto their side immediately. Otherwise, roll them onto their side when the jerking stops. Do not try to move them unless they're in immediate danger. Remove any objects on or around them that may cause injury. Protect their head by placing something soft under it. Time the seizure. An epileptic seizure typically lasts less than 2 minutes. Do not put anything in the person's mouth. Do not try to restrain the person. Observe what is happening to the person during the seizure. Observe what parts of their body are affected and how they are affected. Monitor their breathing and skin color. Make sure you stay with them and reassure them until they have fully recovered. This is Mei Lin and her family. Mei Lin has focal seizures where she may suddenly appear confused or show inappropriate responses or confused behavior. Begin by checking for a response. If they are non-responsive, time the seizure. Protect them from harm, but do not restrain them. Stay with them and observe their behavior. The person may be confused and tired when the seizure ends. Note how long the seizure lasts. Gently reassure them until they have recovered. You will need to call an ambulance if the person is injured. There is food, fluid or vomit in the person's mouth. The seizure occurs in water. The person has breathing difficulties after the jerking stops. Another seizure quickly follows. The seizure lasts longer than 5 minutes or longer than usual for that person. The person is non-responsive for more than 5 minutes after the seizure ends, or if you are in any doubt about what to do. By knowing what to do or what not to do, you can help keep the person having the seizure safe. If you would like to download any of our first aid posters, please visit our website at www.epilepsy.org.au/first_aid_posters. We offer a range of free and confidential services to support people living with epilepsy. Call us on 1300 374537 and one of our friendly staff can answer your questions about epilepsy and link you with information and resources to support everyday living. We can provide epilepsy education no matter where you live in Australia. Need an interpreter? No problem. We can arrange an interpreter too. We invite you to take a look at our website, follow us on Facebook, or give us a call. Epilepsy Action Australia, providing life-changing support.